As I mentioned before, at HSA we offer a full complement of services where we participate with, for example, public health, in terms of public health campaign, in advising people what are some of those things that we can do in terms of our diet and exercise that may be able to reduce the risk. Then secondly, the second aspect is about early detection. And simple things like breast self-examination. That is one key way, because there are many of our women who self-diagnose. Actually, they find the lump and they come in. But separate and apart from that, we at HSA, we offer a full complement of different technology for early detection. We offer mammograms, we offer breast ultrasound, we also offer MRI. These are immediately there that can help to identify lumps in the breast and the axilla that may be cancerous. Then we have a whole suite of different surgeons. We have the interventional radiologists who will just use a little needle to do a small biopsy to diagnose it. We have the pathologist service. It's going to be the pathologist, who's the doctor now, who looks at this specimen to determine whether or not this is cancerous or not. And then, depending on what is happening, our clinical team, which consists of the surgeon or the oncologist, like myself, we will then examine the woman and determine if she's diagnosed with a cancer. Then we begin to do different things to develop the staging. We have CT scans to help to stage whether or not the person has disease anywhere else, whether it's in the lung, liver, bone, and so on. Right? But we also, we will refer patients to do more high technical tests. For example, we want to PET scan to determine if there's other distant spread of cancer. But separate and apart from the technology to do that, we offer the array of clinical services. I mentioned two important aspects of it. One is surgeon. Breast cancer is always a surgical pathology, right? And depending on the stage, then different types of surgery may be offered. Of course, depending again on the stage, depending on what are some of these different features of the cancer, then the persons will often come over to our hematology oncologist service, where we be able to offer a wide array of treatment options. And these include from hormonal therapy, which we call endocrine therapy. We offer different targeted therapies, which include immune therapy. We offer various chemotherapy options, right? And there are different types of breast cancer that may require going overseas. That includes if they have to have radiation therapy, because it all depends on what surgical procedure is done, as well as it depends on the stage of the disease. Just a simple example. If someone has a very, very large breast mass, right? The cancer is big on the breast and oftentimes have lumps under the axilla, then those patients more often than not would benefit from radiation. If a woman has a small cancer and she does what we call lumpectomy, meaning they just remove the small lump alone and there's no residual disease anywhere else, then she would benefit from radiation. That's just putting it very simplistically, right? So apart from that, we have gone through the gamut of what are the various treatment options: chemotherapy, endocrine therapy, immune therapy, targeted therapy, and we establish a relationship with our patients. We treat our patients as family. Our patients have an open line to call on us at any point in time and to come and see us at any point in time. We have a talented staff of nurses who know each patient individually, who will counsel each patient individually. We are linked with our nutritional service, who provide consultation on nutrition, because we believe that during that process, when someone has a cancer, it is important to have appropriate nutrition. Right? We also have a linkage with our psychology department to help our women and family to cope, because going through a period where you're diagnosed with a cancer and you may need to have aggressive treatment, because not all treatment is mild, some of them is aggressive. And so in order for the patient to cope and their caregivers to cope, we have a linkage with our psychology department. After treatment, we do not give up on our patients. We continue to follow up our patient for many, many, many years. And even though our patients have other conditions, so you may have diabetes as well as hypertension, we treat everything under this one unit. We manage all our patients' conditions. And I mentioned diabetes. Our patients have a quick link, a direct link to our diabetologist, who is our diabetic pharmacist, who will help our patients to really manage their diabetes better. One other important thing as I close, this weekend, over the next few days, we'll be having the annual healthcare conference. And in this, we'll be expounding on breast cancer and many other cancers. But we'll be looking at some of these very things that we're talking about. What are these new things, these new developments that we are offering, or these new developments that are available otherwise, whether in terms of diagnosis, treatment, follow-up of our patients, including things like offering genomic sequencing to determine sometimes whether someone has a particular gene that predisposes them to breast or other cancers, and then one be able to make an informed decision on what needs to be done. Or on the other hand, the patient has an established cancer and we may want to know what are some of these genetic drivers that drive the cancer, so that we can target them with what we call targeted treatments. So this is what we have. We are building, we are getting better and better every single day. And I will always say, our patients are our number one concern every time, and we care for them.